Hello, my friends. As a urologist and senior health specialist with over 3 decades in clinical practice, today I want to have one of the most important and potentially life-saving conversations you'll ever hear about senior health. We're going to talk about 5 common medical tests routinely ordered for adults over 70. Tests that many doctors prescribe automatically, but which, in truth, may cause more harm than good. And here's the part that deeply concerns me. Most seniors never realize that they have the right to question these tests before agreeing to them. You see, in medicine, we often assume that more testing means better care. But when it comes to people in their 70s, 80s, and beyond, that assumption can be dangerously misleading. The truth is, some of these tests can lead to unnecessary anxiety, false diagnoses, invasive treatments, and even serious complications that diminish, not improve, your quality of life. So today, we're going to change that. We're going to shed light on the medical realities that are too often left unspoken. Realities that every senior and every family caregiver deserves to understand. Welcome back to our channel, where patient advocacy comes before medical protocol, and where informed decision-making replaces blind compliance. Whether you're over 70 yourself, or you're caring for an elderly parent or loved one, what you're about to learn could be life-changing. Because here's the uncomfortable truth I've witnessed again and again over my 30 years in geriatric urology. There are at least 5 medical tests routinely ordered for seniors that frequently lead to overdiagnosis, overtreatment, and avoidable suffering. Yet, astonishingly, over 90% of physicians never discuss the full risks and benefits of these tests with their older patients. That's why I believe this conversation is long overdue. Now, I'm often asked by my patients, "Doctor, I'm 73, and my doctor wants to order a PSA test, a colonoscopy, and several other screenings. But I've heard that some of these might not be necessary, or could even be harmful. What should I do? Which tests should I question?" This is one of the most common and most important questions I receive. And it comes from everywhere. Seniors who are overwhelmed by aggressive testing schedules. Families who feel uneasy watching their loved ones go through uncomfortable or risky procedures. And caregivers who simply want to know what's truly best for their aging parents or spouses. The message is clear. People are starting to realize that more medicine doesn't always mean better medicine. And after age 70, that realization can make the difference between protection and harm. Here's the medical reality that few doctors communicate clearly. After 70, the rules change. Medical testing for older adults requires a completely different risk-benefit analysis than for younger people. What might save a life at 50 could cause significant harm at 75. But unfortunately, our healthcare system often applies the same blanket testing protocols across all age groups, ignoring the fact that seniors have unique physiological needs, different life expectancies, and distinct quality of life priorities. That's why in geriatric medicine, the key principle is individualization. Every medical decision should be guided by your overall health, your goals, and your values, not by an outdated checklist. Because when we treat seniors with a one-size-fits-all approach, we risk doing the opposite of healing. We create fear, confusion, and sometimes irreversible harm. So today, I'm going to walk you through the 5 most overordered medical tests for adults over 70. Why these tests can be potentially harmful at this stage of life. What the latest medical evidence really says about their true risks versus benefits. And finally, the critical questions you should ask your doctor before agreeing to any of these procedures. Because when you're informed, you're empowered. You can protect yourself or your loved one from unnecessary medical interventions, while still ensuring you receive the care that truly matters. So stay with me until the end of this discussion, because what you're about to learn could prevent unnecessary suffering, safeguard your independence, and help you live not just longer, but better. This isn't about rejecting medical care. It's about choosing smarter, safer, and more personalized care. Let's begin with the first test on the list. One that's ordered millions of times every year, yet often does more harm than good for seniors over 70. But before we dive in, like this video, and if you're new here, subscribe for more insightful content like this, and leave a comment saying I subscribed, so we can welcome you personally. Medical test number 1. PSA screening for prostate cancer after age 75. Let's start with one of the most overused and potentially harmful tests in older men, the PSA blood test for prostate cancer. Now, this might surprise you, But the U.S. Preventive Services Task Force clearly recommends against PSA screening for men over 70, because the harms far outweigh any possible benefit. Here's why. Prostate cancer in older men is usually slow-growing. In fact, by the time a man reaches his mid-70s, he's far more likely to die with prostate cancer than from it. But here's the trap. Once a PSA test comes back slightly elevated, it often triggers a cascade of invasive interventions. Painful prostate biopsies that can cause infections, bleeding, and urinary complications, followed by surgeries or radiation treatments that can lead to permanent incontinence and erectile dysfunction, all for cancers that would likely never have affected your natural lifespan. A landmark study published in JAMA followed over 76,000 men and found that PSA screening after age 70 provided no survival benefit whatsoever, but caused significant harm through overdiagnosis and overtreatment. So if you're over 70, especially over 75, and your doctor recommends a PSA test, pause and ask these questions. Given my age and overall health, what is my actual life expectancy? Am I more likely to die with prostate cancer or from it? What are the specific risks and long-term effects of the biopsy or treatments you're suggesting? Because informed consent isn't just a medical formality. It's a right, and in this case, it might protect you from unnecessary harm. Medical test number 2, routine colonoscopy after age 75. Now let's move to another extremely common and frequently unnecessary test, the routine colonoscopy. For adults under 75, colonoscopy is one of the most effective tools for preventing colon cancer. But beyond that age, particularly if you've already had normal previous screenings, the balance shifts. Here's the medical reality. After 75, the risks of colonoscopy rise sharply, especially the risk of colon perforation, severe bleeding, and anesthesia-related complications. In fact, studies show that seniors over 75 face a 3- to 4-fold higher complication rate compared to younger patients. And even if polyps are found and removed, the procedures themselves carry added danger, while offering minimal benefit to those with limited remaining life expectancy. That's why the American College of Physicians recommends against screening colonoscopy in adults over 75 with average risk and prior normal results. Because at that age, the likelihood of finding a life-threatening colon cancer is extremely low, while the risk of harm from the procedure is significantly higher. Here's what you should ask your doctor. Given that I've had normal colonoscopies before, what's my actual risk of developing a colon cancer that would affect my lifespan? What are the complication rates for people my age? Are there safer, non-invasive alternatives, like stool-based tests, that could provide the same peace of mind? Remember, smart screening isn't about refusing tests. It's about choosing the right ones at the right time for the right age. Medical test number 3, routine mammography screening after age 75. Next, let's talk about mammograms, a deeply emotional and often misunderstood topic for older women. Mammography has saved countless lives among younger women, especially those between 50 and 69. But after 75, the evidence tells a very different story. Studies, including one published in JAMA Internal Medicine, reveal that mammography in women over 75 often detects many cancers. But treating those cancers does not improve survival. Instead, it leads to a chain of interventions, surgeries, radiation, and chemotherapy that can cause fatigue, pain, and long-term complications, all while failing to extend life expectancy. The greater harm, however, isn't just physical. It's emotional. The anxiety of false positives, the fear that comes with unnecessary biopsies, and the decline in quality of life from aggressive treatments targeting slow-growing tumors that pose little to no real threat. For many elderly women, the treatment ends up doing more harm than the cancer ever would. So before agreeing to another mammogram, ask, given my current health, what is my realistic life expectancy? If a slow-growing cancer is found, would treating it actually extend my life, or just reduce my quality of life? What does the current medical evidence show for women my age? Because true health care isn't just about detecting disease. It's about preserving dignity, comfort, and the years you still have to live well. Medical test, question number 4. Aggressive diabetes screening and strict glucose control in frail elderly patients. Managing blood sugar is undeniably important in diabetes care. However, when it comes to elderly patients, particularly those who are frail or have multiple health conditions. Overly aggressive glucose control can do more harm than good. Pushing for tight glucose targets, such as an HbA1c level below 7%, may seem beneficial on paper. But in reality, such strict control significantly increases the risk of dangerous hypoglycemia, low blood sugar, which can lead to confusion, dizziness, falls, hospitalizations, and even death in vulnerable older adults. In fact, numerous studies have shown that aggressively lowering blood sugar in elderly patients doesn't reduce mortality. It actually increases it. The complications of hypoglycemia often outweigh any potential long-term benefits, especially for those with limited life expectancy. Recognizing this, the American Diabetes Association now recommends more relaxed glucose targets for older adults with multiple chronic illnesses or reduced life expectancy. For many seniors, maintaining an HbA1c between 7.5% and 8.5% is not only acceptable, but safer and more appropriate. Despite these recommendations, some doctors still push for tighter control, unaware of the risks this can pose to frail older individuals. Key questions to ask your doctor. Given my age and overall health, what is a safe and appropriate glucose target for me? What are the risks of aiming for a very low HbA1c? Could a more relaxed approach to blood sugar management actually protect my health and improve my quality of life? Medical test. Question number 5. Routine cancer screening using CT scans and advanced imaging in the elderly. Many well-intentioned doctors order routine CT scans, PET scans, or MRIs for elderly patients as a way to just check for cancer, even in the absence of symptoms. However, these tests come with serious downsides that are often overlooked. First, these scans expose patients to significant amounts of radiation, which can be harmful, especially when repeated. More importantly, they frequently uncover incidental findings, minor abnormalities that are unlikely to ever cause harm during a person's remaining lifetime. But once these incidental findings are discovered, they often lead to a domino effect of further tests, invasive biopsies, surgeries, or treatments that may carry real risks, bleeding, infections, pain, anxiety, without offering any actual benefit in terms of life expectancy or quality of life. One major study published in JAMA Internal Medicine found that 23% of elderly patients who had follow-up procedures due to incidental findings from imaging experienced complications. Yet there was no improvement in survival. This highlights a critical point. Just because we can find something doesn't mean we should go looking, especially when the search itself may cause more harm than help. Key questions to ask your doctor. At my age and health status, is this imaging scan truly necessary? What will we do with any findings that turn up, especially if they're minor or uncertain? Could this test lead to further procedures that might harm me more than help me? The smarter way to approach medical testing after 70. Before agreeing to any medical scan or screening, it's vital to pause and ask yourself a few crucial questions. What specific symptom or concern makes this test necessary? How likely is it that the results would truly change my treatment or extend my life? And what are the risks of uncovering something that leads to unnecessary or even harmful interventions? These are not just theoretical questions. They can mean the difference between years of vitality and years of suffering. Let me give you a powerful real-world example. A 78-year-old patient came to my office, anxious and confused. His primary doctor had ordered a routine PSA test, a blood test that screens for prostate cancer, despite his age. The results came back slightly elevated, which led to a biopsy. That biopsy triggered a serious infection that landed him in the hospital. And what did the test reveal? A slow-growing prostate cancer that was unlikely to cause any harm in his lifetime. Still, his urologist recommended immediate surgery. When I evaluated him, I estimated his life expectancy at 8 to 10 years based on his overall health. The type of cancer he had would typically take 15 to 20 years to cause symptoms. In other words, if he did nothing, it would never affect his life. But if he had the surgery, he faced near-certain incontinence and erectile dysfunction for the rest of his days. Side effects that would have destroyed his quality of life without extending it. So together, we chose a different path: active surveillance, careful monitoring with no aggressive treatment. 5 years later, at age 83, he's still living fully. The cancer hasn't progressed. Had he followed the original recommendation, he would have spent his final years in diapers, robbed of dignity, for no survival benefit. And sadly, his story isn't unique. I've seen hundreds of elderly patients harmed by tests and procedures that never should have been ordered in the first place. The evidence is clear. Most major medical organizations now advise against routine cancer screenings for adults over 75 with limited life expectancy. The potential harms outweigh the benefits. Testing should be individualized, based not on age alone, but on overall health and realistic life expectancy. A vibrant 75-year-old is not the same as a frail one. The key question isn't can we find disease, but rather, will finding and treating it actually improve my quality or length of life? For many older adults, the honest answer is no. You have the right to say no. A doctor's order isn't a command. When evidence suggests a test may do more harm than good, you are within your rights to refuse. The 3 questions every senior should ask before any test. What's my realistic life expectancy based on my overall health? If it's under 10 years, most cancer screenings offer little to no benefit. If this test finds something, what treatments would follow? And what are their risks? If the treatment risks are high, the test may not be worth the potential harm. What does the medical evidence say for someone my age and health status? Don't settle for standard protocol. Ask for evidence, not assumptions. You have the right to be an informed, empowered patient. One who makes decisions based on personal priorities, not on blanket medical routines designed for younger, healthier individuals. Thank you for joining us today. If something in this message resonated with you, share it in the comments below. We'd love to hear what spoke to you most and how you plan to carry it forward in your own life. And if you found this video helpful, please like, subscribe, and share it with someone who might need this message. Your support helps us continue creating content that informs, uplifts, and empowers. We'll see you in the next video. Until then, take care of yourself. You deserve it.